Hello friends, let's have a quick look at a reasoning question. Blood glucose regulation by insulin can be termed feed-forward feedback regulation, or you can say feed-forward negative feedback regulation. Explain why. Now, negative feedback is easy to understand. What about feed-forward? What is the story behind feed-forward? Let's understand this. Let's first see the negative feedback, which is easy to understand. When we eat meals, blood glucose increases, and then in response to that, the insulin is secreted. This blood glucose, some of it enters the pancreatic beta cells and causes insulin release, and then the insulin pushes the glucose into the cells, so it decreases the blood glucose, and thereby it's a classic negative feedback. Blood glucose had increased after meals, insulin will push it into the cells, the glucose is pushed from the blood and the blood glucose decreases, so opposite has been done. That's a classic negative feedback. What about feed forward? Yes, that's the part to be understood. What is feed forward regulation? When a change is expected, anticipated, even before the change has actually occurred, the controller takes the action, and that is called as feed forward. In anticipation of a change, if some action is taken, that's called as feed forward. So it happens here. When we eat meals and the nutrients reach the small intestine, now the blood glucose is going to rise. It has not increased right now, but these nutrients are sensed, particularly carbohydrates, glucose, that is sensed by the cells, K cells and L cells in the intestinal lining. And these cells then, they secrete the incretins, incremental insulin secretion, incretins. These incretins are secreted. These incretins are GLP-1 and GIP, glucagon-like peptide type 1, so that's GLP-1, and GIP, previously called as gastric inhibitory peptide, now called as gluco-insulinotropic peptide. So incretins are released by these intestinal cells. They reach the pancreas and they cause insulin secretion. Now watch it. It's a kind of a signal that nutrients have come. That means the blood glucose is going to now rise, and therefore you need to take the action. That kind of a signal is sent from by the incretins to the pancreas. Beta cells of the islets of Langerhans will then secrete insulin in anticipation that the blood glucose will rise now that the nutrients have been consumed. So this is feed forward, in anticipation that the blood glucose is going to increase now because meal has been consumed. In anticipation of a rise in blood glucose, incretins are sensing that those nutrients and going to the pancreas and causing release of insulin. This is feed forward, and therefore insulin and its regulation of glucose can be termed as feed forward negative feedback type of regulation.